COVID has wreaked havoc on our community. We have rapid testing, and so we see COVID patients every day, and that is just dropped into our regular schedule. So in between my other patients, we run out into the parking lot and see COVID patients in their cars. I had a middle-aged man a few weeks ago who was diagnosed with COVID, and he was in tears. He was so terrified when I told him the test was positive, and he was having chest pain and he was short of breath and his oxygen was running low. It was in the high 80s, but usually around 88% is when we start putting people on supplemental oxygen and they absolutely need to be in the hospital. But he had recently been in the hospital for a different condition and owed our local hospital several thousands of dollars in medical bills. I mean, his family was bankrupt already because of a prior hospitalization. And so he didn't want to go back because he didn't want to be any further in debt. And so he and I and his wife, all in tears, sort of in the parking lot, made a plan for how we were going to keep an eye on him and at what point it was going to be worth the risk to them financially for him to go into the hospital. As a physician, in this current lack of a healthcare system, I'm having to help my patients choose between their physical health and their and financial bankruptcy. And I'm not qualified to make that decision for anyone. You know, people have children, people have families that depend on them. And for some people, that's more important to them than their own lives. And it is heartbreaking to have to watch people make that kind of a choice.